Hello, this is Dr. Ford Brewer with Heart Attack, Stroke, and Cancer Prevention. The question today is, will cinnamon prevent heart attack, stroke, or cancer? A lot of people would tell you that it will. What's the research show? Well, the research would indicate that cinnamon can have an impact on glucose levels. If it does, then maybe it can help prevent diabetes, and then obviously anything that can help slow down diabetes is going to help with heart attack, stroke, and cancer prevention. Now, what do the studies show? None of the studies that I saw really showed a significant impact on lipids, cholesterol. Lipids are cholesterol and fats in your blood. None of them showed a significant impact on hemoglobin A1C. So it doesn't appear to have a large impact on your blood glucose averages. Now, it does, however, a couple of studies did show a significant decrease in fasting glucose. If you look at Cochrane studies, let me just clarify Cochrane studies for a minute. Remember, the Cochrane Agency is basically a nonprofit group. It's like Wikipedia, and in fact it's now associated with Wikipedia. Basically it's volunteers from across the world who are for the most part scientists and epidemiologists who agree to look at the research that's out on a topic. They do meta-analyses. A meta-analysis is not just one study, but it's going back and taking a look at all the studies that are available on a topic. The most recent Cochrane review that I've seen on this topic, cinnamon, was 2011, 2012, and at that time there were a couple of independent reviewers. They both came up with the same thing. There were about a dozen studies they looked at. As I said a minute ago, none of them showed significant impact on hemoglobin A1C or lipid levels, cholesterol levels. According to the Cochrane study, they didn't show an impact on anything, and they did have significant opportunity for bias, and there were very small numbers in the studies. So the Cochrane analysis would say no, it doesn't work at all, at least according to the current state of the science. They did acknowledge that it's an important topic and recommended further analysis, which most scientists are going to recommend further analysis. Now, where did all this come from? Again, there were some studies which showed some decrease in fasting glucose. Now, here's another problem. If you're full-blown diabetic, once you get to where your fasting glucose numbers are like 140, 150 and higher, then fasting glucose does appear to become a major issue. However, if you're less than that, if you're pre-diabetic, the real problems don't appear to come from fasting glucose. That's consistent with the perception and the evidence that's out there that glucose becomes a problem once it's 140 or above. Well, logically, let's go back and apply that information to cinnamon. Cinnamon may decrease your fasting glucose. If you're a pre-diabetic and your fasting glucose is 90 to 110, 120, it's not likely to help you that much. What you need is something to decrease your postprandial or your post-meal glucoses, which get up in your typical pre-diabetic 140 to 180. So that's a couple of problems with the whole cinnamon story. Let me add another one. I mean, again, like so many things in life, it's just, there's a quote attributed to Winston Churchill, Mark Twain, several other people, and life is just one damn thing after another. And it's true. Again, those of us who are in the baby boomer culture remember Rosanna Dana saying, it's just, there's always something. So here's always something else. Let's say you decide you're going to take cinnamon anyway. What type do you take? Did you know that there are multiple types? The research has been done with Ceylon cinnamon. So I went to look at the cinnamon that I take cinnamon, by the way, and we'll talk about that in just a minute. I went to look at mine, and mine says Burmanii. It's hard to read. There you go. Now, so again, the research has been done with Ceylon. What you'll find multiple places where you get cinnamon Burmanii, and then you'll also see a lot of literature indicating that cinnamon Cassia is the right one. Well, think back on your history. Ceylon and Burmanii are almost the same place. And in fact, cinnamon Cassia, cinnamon Ceylon, cinnamon Burmanii are all the same type of cinnamon. Here you get yet another image and comparison. Now, interestingly, you see that this is implying that Ceylon cinnamon and Cassia cinnamon are different. Again, it's always something. So let's say you decide, okay, I'm going to take any of the three, Ceylon, Burmanii, or Cassia. I think all of those are safe if you decide you want to take that. Here's what not to take. Korintje and a couple of the other brands, the other types, they came from other parts of the world. And they may end up being helpful, but again, haven't been researched that well. Now, again, I gave a little bit of spoiler. The question is, do I take it? And the answer is yes. Why? It's $6 for 2 months, and I don't mind the occasional cinnamon burp that you get afterwards. In fact, it's a pleasant little surprise sometimes after coffee. But do I depend on it to prevent my diabetes, heart attack, stroke, cancer? Absolutely not. As you may have known from other videos, I am pre-diabetic. Have been probably mild pre-diabetic for a few years. My fasting blood glucoses are in the 90s, sometimes low 100s. But it's my postprandial, like most. It's my post-meal glucose values that have gotten to be problematic. They were in the 120s, now they're up in the 150s, 160s. I tried exercise, resistance training, high-intensity intervals, running. I was a poster boy for all of that for a long time, and I do think that it had an impact on delaying the progression of my prediabetes. I'm at the point, however, that I needed something else. So I went to a very low-carb diet, a la Richard Bernstein. 50 grams, usually 50 grams of carbs or less per day. That made a huge impact on my postprandial glucose. The other thing I've done is I've gone to pioglitazone and metformin. So I started out with pioglitazone, had a little bit of swelling. I'm on metformin after some of my research on the two, and have seen one blood glucose over 100 in the past 3 months.